Ladies and gentlemen, Mr. Chairman, the subject of my talk today is a new ambulatory treatment for hemorrhoids. Anatomic studies demonstrated that the superior rectal artery exclusively contributes to the blood supply of the corpus cavernosum recti and the rectal mucosa. And the arteries supplying the corpus cavernosum recti are not found in the locations stated in the literature. We based our procedure on the hypothesis that the closure of the terminal branches of the hemorrhoidal superior artery causes a reduction of blood flow to the hemorrhoidal plexus, a reduction of volume of hemorrhoidal piles, and finally, an improvement of hemorrhoidal symptoms. HELP is the acronym for hemorrhoidal laser procedure, and it consists of a Doppler-guided dearterialization of terminal branches of superior rectal artery by means of laser energy. If compared to other types of laser, the 980 nanometer diode laser has small dimensions, is portable, manageable, and accurate. To define the best parameters to be used, experimental studies on pig tissue specimen have been conducted, and thermal measurements on the effects of the laser shot on tissues have been studied. A 980 nanometer diode laser delivering 12 watt of energy through an optic fiber causes a coagulation and shrinkage of tissue to a depth of approximately 5 millimeters. And to define the best wavelength for the procedure, it's important to define the type of tissues that the laser beam has to cross. As a matter of fact, the laser beam has to cross the rectal mucosa, which has not to be damaged, and we don't want to cause any damage, also bleeding of the mucosa. On the other side, it has to be absorbed by the arterial vessel in order to trigger the coagulating effect. And the penetration in tissue is inversely proportional to the absorbing capacity of tissue itself. These are the study on the absorption spectra of water and blood, and just to define the best wavelength to use. And you can see the water has a very low absorption rate, whereas blood has a very high absorption rate. And experimental studies show that 3 laser shots of 12 watt each are necessary to create the coagulation. As a matter of fact, the type of irrigation has to be pulsed mode, because a continuous irrigation can cause evaporization and burning of the soft tissue, whereas a pulsed mode causes a more selective shrinkage of the arteries. These are the instruments that are showed in the video. A proctoscope is inserted into the rectum of the patient, and there is a small window that holds the Doppler probe, which is necessary for the localization of the arteries, and then is removed and inserted a laser probe, which delivers the radiant energy to the arteries that are closed. And then you can check that the arteries are closed by introducing again the laser probe, as it is associated with the disappearing of the sound. And then you do the same thing to find all the arteries about 3 centimeters proximal to the dental line. And these are the final scene. Indications are symptomatic 2nd and 3rd degrees hemorrhoids with initial mucosal prolapse. And we evaluated prospectively 20 patients with a mean age of 47 years, 2nd degree hemorrhoids in 12 cases, 3rd degree hemorrhoids in 8 cases. Major symptoms were bleeding, but also acute episodes requiring medical treatment, more than 3 episodes a year in most cases. And here are the results. No anesthesia is required for this kind of treatment. Only in 2 cases, analgesic drugs intraoperatively were administered at the patient's request. Mean operative time was 9.5 minutes. We had 4 intraoperative bleeding. In 2 cases, they were treated directly with a laser shot, and in 2 cases, surgical hemostasis was necessary. Mean postoperative pain was very low, and as a matter of fact, only 3 patients required analgesic drugs postoperatively. And then at a mean of follow-up of 6 months, 90% of patients were cured for symptoms with an overall satisfaction rate of 90%. And what was interesting was a reduction of the volume of hemorrhoidal piles of at least 1 grade, as you can see in this slide, in 80% of patients. So ladies and gentlemen, Mr. Chairman, the HELP procedure is safe, effective, doesn't require anesthesia, can be performed as an office treatment, is easy to perform, repeatable, has a high patient's compliance, and is indicated in symptomatic hemorrhoids with initial prolapse. Thank you very much for the attention.